Hi everyone, I am Dr. Radhika, Obstetrician, Gynaecologist and Laparoscopic Surgeon. Today I want to share with you all regarding what are all the gynecological tests we have to do, how often we have to go for the routine gynecological checkups, and what are the preventions for some of the gynecological diseases. Doing yearly health checks will prevent some diseases. So what we will see whenever patient comes. So we will do general examination. We will see whether she is having any anemia. We'll inquire about her periods. So in the periods, let me tell you certain important things regarding periods. So the normal period. What is normal period? The normal period usually stays for 3 to 5 days. And the bleeding will be moderate, mild to moderate. It should not be heavy. There should not be any clots. And severe dysmenorrhea, that is severe pain during periods, is not usual. So any period which extends more than 7 days, or if the woman is passing clots, or if her bleeding is heavy, or if her period is associated with the pain, then these are all abnormal things when you have to contact us. Then we'll inquire about the other things, any white discharge. Sometimes it can be associated with the itching also. So this will rule out the bacterial and the fungal infections, and we have to inquire about the urine. So in the married woman, we will do a general gynecological checkup to see if there is any vaginal infections or vulval infections or any cervical reddishness, erosions and cervical infections are there, and we'll check for the uterus and the surroundings for the signs of any masses or any infection. So in the yearly checkups, it is mandatory to have the complete bed picture and the thyroid profile, one ultrasound and one pap smear, and if in the perimenopausal group, we'll also add the mammogram. So let me tell you about the pap smear. What is this pap smear test? So this pap smear test, it is done to know the pre-cancerous lesions or to know the infections. Most of the people think it is for infections, but main thing about the pap smear is to know for the pre-cancerous lesions. So cervix is a region where before cancer is coming, certain changes in the cells occur, which if we catch, we can avoid the cancer cervix. In India, cancer cervix was the most common cancer in the woman in the previously. But now we are seeing cancer breast cases more. So this pap smear, when they have to do? Usually from 30 to 40 years of age, we can go for the pap smears yearly once, and consecutively once the 3 years the pap smear is negative, then you can repeat it after 2 to 3 years once. But today scenario, we are seeing high risk sexual behavior. So people who are having high risk sexual behavior, they can go for the pap smears immediately after they are sexually active or from the 25 years age onwards. It's always better to avoid multiple sexual partners and high risk sexual behavior because you will get contact with the sexually transmitted diseases and certain cancers. Especially the vulval cancer and the cervical cancer are caused by a virus known as human papilloma virus. Next, coming to the ultrasound. In the ultrasound, we see the size of uterus. Are there any fibroids? Are there any adenomyosis? Adenomyosis means it is the thickening of the uterine muscle. And any tubal infections? How about the ovaries? Any hormonal disturbance is there? Any ovarian cyst or any masses in the ovary? All these things will be looking in the scan. And complete blood picture, thyroid profile, and in cases you can also add the renal function test, liver function test, lipid profile and blood sugars, vitamin D, vitamin B12, depending upon situations. Breast examination also we will do, especially in the perimenopausal age group. And here even every woman has to check her breast once a month or very frequently to see for any masses or any discharge from the nipple or any lumps in the armpit. So these are all the precautions which you have to take, which can prevent you from diseases.